Good morning. I'm Trudy Murata, and I'm a volunteer community ambassador with AARP Virginia. And I want to welcome you to Friday Fraudcast, a 30-minute discussion about frauds and scams. Before we start, I'd like to share that AARP is a nonprofit, nonpartisan organization, and that we are in your corner and your community fighting on issues that matter to you and your family. The AARP Fraud Watch Network is a free nationwide effort to arm people with the tools they need to spot and avoid scams. If you've participated in one of our Friday Fraudcasts, you know that this is similar to a radio talk show and that you have the opportunity to ask questions live. If you have a question, please feel free to type it in the comment section below. And let me welcome our guest today. Our guest is Shawn Smith, Director of Virginia Senior Medicare Patrol. Shawn, welcome to Friday Fraudcast. Could you begin by telling us a little bit about Senior Medicare Patrol?
Sure. Trudy, thank you for having me. I appreciate the opportunity to be here. The Senior Medicare Patrol probably is best summed up in its mission, which is its mission is to empower seniors, family members, and caregivers to prevent, detect, and report Medicare errors, fraud, and abuse. And we do that through education, outreach, and counseling.
Very good. Shawn, does this group exist only in Virginia?
Actually, the Senior Medicare Patrol is a national program, and so we exist in 50 states and 4 U.S. territories, and it's funded by the Department of Health and Human Services under the Administration for Community Living.
Very good. Can you share with us some generic examples of what some of the Medicare frauds and scams are?
Sure. And before I do that, I wanted to kind of make some distinctions between errors, abuse, and fraud. So errors are mistakes or accidents or inaccurate information that leads to maybe inappropriate financial repercussions or payments. And they're mistakes that anybody can make. So instead of looking at your bill and it should be for $30 and maybe for $300, you call the provider, they realize it's a mistake, they fix it, it's just an error. Abuse is a mistake or practice that is institutionalized without an intent of really misrepresenting anything. So, for example, when you go to your doctor's office, for every type of service or procedure they do, there's a billing code. And some doctors will use multiple codes for a single procedure. Sometimes that's appropriate, sometimes it's not. When it's inappropriate and they kind of do it as a regular practice, that's considered abuse, but there's no intent there to really defraud the government. What separates errors and abuse from fraud is that there's an intentional misrepresentation of facts or information for the purpose of gaining some type of financial payment or misusing the Medicare program. And so when we work with individuals, we're trying to distinguish between errors, fraud, and abuse. And just some of the most common types of fraud is medical identity theft, where people are trying to secure beneficiaries' Medicare or Social Security numbers for the purpose of using that information to gain financially from having that information. Anything from people getting threatening phone calls from people saying that they're from the Social Security Administration and telling them that they can be arrested because there's fraudulent activity on their account and they're implicated in that fraud. Or people calling Medicare, saying that they're with Medicare, calling beneficiaries, telling them that they're getting rid of the paper ID cards and they're getting plastic cards, and in order to facilitate the mailing of that card, they have to provide them with their Medicare number. That's simple examples of fraud. One case that, I was going to share just one case that recently came about. That's an example of the things that we don't want to happen. We know, first of all, that Medicare and medical benefits are finite, which means there are limits to those benefits. So if someone else is using your benefits, you're not going to have those benefits when it's time for you. And so we had a caller call us and tell us that that for 6 months, a scammer had obtained her medical identity or Medicare identity number and was using it to purchase medications on her card. And so she didn't find out until she went to purchase her own medications. And what usually costs $48 now costs $200. So when she questioned the pharmacist, he was able to tell her that she fell into a coverage gap. So when she went home, she called her physician, she called her insurance company and started to review her MSNs and realized that this had been taking place for 6 months. And so we've opened up a case for her that there's an investigation that's going on. But until then, she continuously has to pay the $200 till it gets rectified. But it all could have been avoided if she had been reading her MSNs on a monthly basis or more regularly.
It's so sad to hear about those instances. A friend of mine got caught up. They tried to get a wheelchair for her mother, and Medicare said she can't have a wheelchair because we just provided her with a $8,000 full electric wheelchair within the last 2 years, and trying to prove to Medicare that she didn't have an existing wheelchair proved to be a little frustrating.
Absolutely.
So it was not in Virginia, but I would have referred her to that state's senior Medicare patrol if I knew all the circumstances involving that. So, Shawn, everyone should be reviewing their explanation of benefit forms that arrive in the mail, usually shortly after an office visit or a testing procedure. What should I do if I spot an error in that information?
Great question. And yes, you're right. Everyone should be looking at the explanation of benefits as well as their Medicare summary notice. And the first thing you want to do is call a provider to figure out if it's an error and have that conversation with them. If it's not with the provider, you might want to call the company that sent the bill. Sometimes they use outside billing sources and there's an error in communication. If you get nowhere that way, then that's certainly a time when you want to call the Senior Medicare Patrol. We have a toll-free hotline. It's an 800 number. It's 1-800-938-8885. And use that number. We can help you sort through some of the details to figure out if it's an error, if it's an abuse, or if it's fraud. And we can get you on the right path to getting that rectified.
Okay. We were going to put that 800 number on the screen. I'm not seeing it. Oh, I'm seeing it now. Okay. The 800 number for SMP is on the screen for you now. With regard to Medicare frauds, how does the Senior Medicare Patrol help the community?
Oh, great. Well, first of all, as I shared, we really go into the community to do education, outreach, and counseling. And so education could look like us showing up at your church group, or showing up at some type of civic event where we're giving a presentation about how to protect yourself or prevent Medicare fraud, how to detect it, and then how to report it. We show up at places with kiosks at things like the state fair or other regional fair events, medical events, to kind of, again, get that word out. But then we also receive beneficiary complaints. So we will receive the phone calls that people have where they're coming to report or at least investigate some suspicion of Medicare fraud. And then for some of those that it's not necessarily fraud or abuse, we will refer them to the right agency to help rectify the situation. So we try our best to both educate and empower people to take care of those things themselves, but also are there to help support them as they kind of walk through some of those systems.
That's a great service, and nice to know that you're there to help us. Since the onset of COVID-19, has there been any new twists to Medicare scams?
Absolutely. And in fact, with any type of natural disaster, it just kind of prevents an opportunity for scammers to take advantage of people that are vulnerable. So with COVID, some of those things have been, at least the most popular ones, have been around testing, around vaccines, as well as safety kits. You have unsolicited calls from individuals saying that they can either provide you with testing or get you testing sources. Believe it or not, people saying that they can get you the vaccine or provide safety kits with MSN mask or disinfectant or gloves or those things. And really, they don't have any of those things to give. They say that those things are going to be covered by Medicare if you're a Medicare beneficiary. And in order to facilitate the purchase of those things, they're going to ask you for your Medicare ID number. And of course, you don't want to give that to them. What we've also seen is investment fraud, where people are calling saying that there's an opportunity for the beneficiary to invest in a COVID vaccine. And so they're asking for money to put towards a COVID vaccine. But also charities are calling saying that they want donations to help people that have been impacted by COVID. And so with all of those, especially the investment donations, you want to make sure that you're doing your research on those particular entities so that you're not just giving your money to someone who calls, but that you know that you're making an informed choice on some of those things. With the testing, the vaccine, and the safety kits, my best advice is always to go to your healthcare professional, your doctor, your physician, and they can always direct you to legitimate sources for these different things. I want to also add that what we've seen popping up around the country are scams around testing sites. So you see testing sites that are popping up in parking lots with tents and medical officials that are taking information from you as well as providing a COVID exam. Some of those are also taking blood work at those particular sites. And what people are finding is that they're using that blood work as well as the information that you're providing and charging for blood testing and other types of services that were not approved by the particular individual that's trying to get a COVID test. And so again, if you need a COVID test or you want to get tested as quickly as possible, talk to your healthcare professional or the health department, and they can direct you to those legitimate places where those things can happen.
Shawn, we've got a question from one of our audience members. And that question is there a database where I can look to see if my doctor is under investigation for fraud?
That's a great question. And I don't know that there's a database. If people are under investigation, a lot of times they don't want to tip them off. However, the Office of the Inspector General under the Department of Health and Human Services is one of the departments where investigations may be taking place, as well as your Attorney General's office. Again, a lot of that information, if they're under present or current investigation, will not be publicized because they want to make sure that, one, they don't want to implicate someone who's not fraudulent, but also they don't want to tip off someone who may be in the middle of a fraud that they're trying to catch. But if there are people that the investigations are complete, your Attorney General's office website will probably have that information, and or what other investigative body, whether it be the FBI or the Office of the Inspector General.
Okay, great. Thank you, Shawn. Unless I am going to the doctor's office, the hospital, a lab, a clinic that particular day for an office visit or testing, should I carry my Medicaid card in my wallet?
Great question. And the answer to that is, generally speaking, probably no. You want to leave that home or in a safe place where you're sure that no one's going to get their hands on it. Of course, the more you take it out, the more you take it with you, the more likely it is that someone can have access to that information. If you feel completely safe and you know that that's not going to be a problem, but generally speaking, if you can leave it home and not let it get into the hands of the wrong individuals, then it's probably best to do that.
Okay. Is it ever safe to give my Medicare number out over the phone?
Great question. There are times when it is safe, and that is when you know that you're talking to someone who is trusted and who needs the information. Certainly, that's going to be few and far between when you're on the phone. But even if it's your doctor's office and if they've requested and you don't feel comfortable giving it out and you know you're going to the office, tell them you'll feel more comfortable providing that information when you show up there. When you call the SMP and we may be filing a complaint, we will ask you for your Medicare number. And again, if you don't feel comfortable giving it at that time, in order for us to finish the complaint, we're going to have to, at some point, need to have that number, and you can give it to us when you feel comfortable. But generally, you want to make sure that whoever's getting that number from you, one, needs that number, and two, is a trusted source that you feel comfortable giving that number to.
Very good. Shawn, it's open enrollment season for those individuals that may choose to select a supplemental health insurance plan in addition to Medicare. I'm getting these phone calls every day from groups that want to help me make that decision. Are these groups legitimate, or are they groups that want to steal my Medicare number?
That's a good question also. So it's possible that some of these groups may be legitimate. However, you never want to give your Medicare number to anyone who you don't know or you're not sure of. If you need help in understanding and getting counseling around what insurances to choose, there's a program called the VICAP program. It's the Virginia Insurance Counseling and Assistance Program. And they work with the AAAs in the state of Virginia. AAA stands for the Area Agencies on Aging. They work with those organizations in Virginia to provide unbiased information on the things you need to consider based on your benefits with Medicare in choosing a supplemental insurance program. What's key is that they're unbiased. If there's an insurance company calling you, they're going to be biased towards their product and against their other competitors. And so listening to those folks, you're probably not going to get the full story. If you work with a VICAP counselor, they're going to be able to tell you all the things you need to know. If you want to reach a VICAP counselor, you can go to VDA, which stands for Virginia Department of Aging, .virginia.gov, and they can get you directed in the right direction.
Okay, very good. Shawn, how about those late night TV ads for durable medical equipment like knee braces and the like? Is it safe to give them my Medicare number?
Again, another great question. So it's possible that those places may be legitimate, but again, you want to do your research. You don't want to just arbitrarily pick something and give them your medical information. Again, if there's a service or a product that you need and it's medically important, talk to your doctor. They can certainly generate a legitimate request for those things if you need them. If there's a product that you see on television, again, do your research. Talk to friends, family, neighbors, medical officials, and really discuss those options and determine what might be beneficial. Check out the organization. Go to their website. Check the Better Business Bureau to see if those companies that are advertising those things are legitimate. But again, your first stop is going to always be your physician. They're going to be able to always lead you in the right direction.
Okay. Thanks, Shawn. We've got the website address and the phone number to Senior Medical Patrol running on the screen and possibly in the comment section as well. So if you have a need to contact the organization directly, that information is available to you. And of course, you always have the Fraud Watch Network available to ask questions or to provide resources by calling 877-908-3360 or go to our website at aarp.org, Fraud Watch Network. And knowing that you are already here on Facebook, you can go up to that search box in the top left corner and type in Fraud Watch Network. Like us on Facebook to get alerts on scams and frauds that can help you, and you can share those alerts with your family and friends. We also have an excellent podcast called The Perfect Scam that includes episodes with a number of frauds and scams from both a victim and a law enforcement viewpoint, where you can find the Perfect Scam podcast on the AARP.org website or wherever you locate your favorite podcast. Shawn, I'm looking to see if we have any additional questions from our viewers, and I'm not seeing any, but if they show up while I'm talking, I'll stop and go to the questions. Shawn, is there anything else that I haven't asked you that you'd like to share with us about Senior Medicare Patrol?
Sure. I'd just love to give some really quick tips on how to prevent yourself from being taken advantage of. And one of those is really just, first of all, a lot of the scams come through unsolicited contacts, whether it be a text message or a phone call. If you get an unsolicited phone call, remember, people are calling you because they want something from you, and you should be suspect of that. And so it's okay to be suspect of unsolicited phone calls. Do your best to listen carefully to make sure, but hang up if you realize that it's a fraud call. Always protect your Medicare and your Social Security numbers the same way that you would your credit card or your banking information. Those numbers, again, are tied to limited benefits, and if someone else is using them, then you are not entitled to those benefits. Keep a record of your appointments and the services and the procedures that you receive, and then you compare that to your explanation of benefits or your Medicare summary notice. And if you look at those charges and you see things on those notices, your EOB or your MSN, that are services that you did not receive, or that they're billing for the same thing twice, or maybe there are medications on there that don't belong to you. Those are the things you want to look for and recognize, and then also start to track down to make sure that it's either an error or that it's a fraud, and you can then deal with those things. But certainly protect yourself, and don't worry about, again, Medicare and Social Security are rarely, if ever, going to call you out of the blue. If they call and say that's who they're from, more than likely it's a scam.
Very good. Shawn, thank you so much for taking the time to talk with us today. I'd like you to stay on. We've got a couple more topics that we're going to go to now, but please feel free if you have anything else to add or share, jump in at any time. I know that we've shared a number of follow-up resources that you can go to identify and protect yourself from frauds and scams, but I'm going to share one more with you today, and that is Fairfax County's Scam Slam that you can access online. And we are listing how to find Fairfax County's Scam Slam in the comment section, but I can tell you from personal experience, all you really need to do is to Google Fairfax County Scam Slam, and it'll take you right to the website. Scam Slam, I knew I was going to do that. Scam Slam describes current scams that are circulating throughout the community via phone, text, emails, even unlicensed solicitors at your front door. And it only takes a few minutes to listen to each episode, and the information provided at Scam Slam is valuable to everyone, whether you are in Virginia or across the nation. And today we're going to add something that I'm calling Scam of the Week. We've been asked by local law enforcement to advise our Fraudcast audience about a particular scam that is circulating around Northern Virginia. It is a nationwide scam, but it appears to be targeting us locally at the moment. So I'm going to bring in my colleague, Martin Bailey, to talk a little bit about this postal-based scam.
Good morning, Free. How are you doing?
Morning, Martin.
Yeah, this scam involves a letter that threatens you with an IRS lien or levy. And the lien or levy is based on a bogus overdue tax liability supposedly owed to a non-existent agency. This non-existent agency probably has a legitimate sounding name, something like the Bureau of Tax Enforcement or Benefit Suspension Unit. However, remember, there are no such agencies. This scam may also reference the IRS or Social Security Administration to confuse potential victims in thinking that the letter is legitimate. If you receive this, you have to know that Social Security will never threaten you with a benefit suspension, arrest, or other legal action if you do not pay. If you receive this letter, text, call, or an email that you believe to be suspicious about an alleged problem with your Social Security number, account, or payments, hang up and do not respond. Also, do not respond to the reference number contained in the letter that you have. Thank you, Trudy.
Thanks, Martin. I just want to whoops, I'm muted again. There we go. I'm back. Sorry about the sirens in the background, but that happens. Just to reinforce what Martin shared with us, if you receive a letter like Martin described, do not call the number that is on the letter. By calling that number, you are calling the scammer, and it just takes you further down the rabbit hole. So just be cautious of that, and also share that information with your neighbors. If you receive a letter, they're receiving the same letter, and we all need to know that that is a fraudulent letter, and that you don't owe I've seen two letters so far, one that said they owed $16,000, one that said they owed $9,000 in back taxes. So just do your research, contact a legitimate agency to make sure that you don't have any of those tax liens against you. But that letter is a fraud and a scam, and we need to get it stopped as quickly as possible. I'm looking one more time for any additional questions. I don't see any, so I'm going to say on behalf of AARP and Fraud Watch Network, thank you for joining us today and taking place in Friday Fraudcast. Please join us here next week. Next week, I'll be talking with Christine Kiefer from the Financial Industry Regulatory Authority Education Foundation to talk about frauds and scams in our neighborhoods and how to protect yourself. And as we close today, I just want to remind you that the scam artists are out there looking for new ways to scam their next victims, but you have the power to protect yourself and to become more aware of the frauds and scams and be alert to your surroundings. If you can spot a scam, you can stop a scam. Please visit Fraud Watch Network at aarp.org/fraud. Check out the site map that includes and identifies, I should say, scams and frauds that are happening across the nation. Don't forget to like us right here on Facebook. You can even follow us on Twitter and listen to our podcasts on The Perfect Scam. I hope you learned something today that will protect you in the future. I'm still not seeing any additional questions, so I'm just going to say, Shawn, thank you so much for taking your time to talk with us today. Whoops,
Thank you
hold
for
on.
having me. I appreciate it.
I'm not letting you off the hook yet. Hold on.
Uh-oh.
There's a question that comes in that says, do doctors get to keep their license after they are found guilty of frauds?
Again, a great question. In many cases, the doctors may have the license suspended and also suspended from an opportunity to work with Medicare or other insurance agencies. Sometimes those suspensions are temporary, sometimes they're permanent. It just depends on the case and the severity of the fraud.
Great. Good. I'm glad you stuck around with us for that extra couple of minutes. I appreciate it. Shawn, thank you for your time and your information here today. Martin, thanks for helping me out on the tax levy scam. I will see you next Friday, same time, same place, with the Financial Authority Regulatory Board. And until then, wash your hands, wear your mask, lock your doors, lock your cars, don't click on the links. Have a great day and stay safe. Thanks. Bye.
Thank you so much. Bye-bye.
Thank you.